They bravely served our country, but now they're in a new fight, veterans battling COVID-19. Only on 9, the head of the VA breaks down what he's doing to keep our heroes safe from the virus. Now at the Salisbury VA, there have been 114 cases of COVID-19 and 16 deaths.
And one of the hardest hit nursing homes in the state is the Veterans Home in Salisbury, already reporting dozens of cases and 15 lives lost. Secretary Robert Wilkie met with VA doctors and nurses in our area today and spoke only to our Tina Terry, who is joining us now live. Tina, what are some of the actions the department is taking?
Well, yes, Secretary Robert Wilkie says he is deploying experts to our area as well as working on clinical trials of new drugs. He's also keeping a very close eye on state data in order to stay ahead of this virus.
Inside Salisbury's VA and the North Carolina State Veterans Home, nearly 160 people have battled COVID-19. 31 have died. All the while, VA Secretary Robert Wilkie has worked to keep the worst at bay and give veterans nationwide weapons to fight back.
We were the first ones to stop elective surgeries. We were the first ones to actually test people before they actually entered into our hospitals.
They've also taken part in clinical trials and have welcomed veterans' rights to try experimental treatments like the drug remdesivir.
We provide hope in terms of an outlook, the outlook for a veteran, and we give them every avenue possible to explore ways of getting healthy.
But as state health officials express concern over the increase in COVID-19 hospitalizations, Wilkie is paying close attention. In recent weeks, the department has sent in experts to assist with outbreaks at state veterans' homes like the one in Salisbury.
Nurses, our gerontologists, our technicians will go in and help try to stem the crisis in those facilities.
And he says preventative measures that have helped keep the worst at bay could remain in place here.
We're not going to return to full operations until we can say that the surrounding community has experienced a leveling off of the infection rate.
Now listen to these numbers nationwide. The VA system says that it has reported just over 15,000 confirmed cases, but that is out of about 9.5 million veterans. So those numbers are much lower than they had expected. And regarding that drug I told you about, remdesivir, they say that the one Salisbury patient who requested it was in the ICU. After taking it, he is now doing much better. Back to you at the desk.
All right, Tina, thank you very much. Actually, U.S. senators want a federal investigation into COVID-19 deaths at VA homes. Last month, they sent a letter to the Government Accountability Office, and they want to know whether the VA and states have a system to identify real-time spikes in deaths. It follows the death of more than 70 veterans at a VA home in Massachusetts.